Does the coronavirus know who's black and who's white? Of course it doesn't. But when it gets hold of black, Asian and minority ethnic people in the UK, there's more chance they'll die from it. It's a stark observation and one which has crippled so many families. When Lorraine contracted coronavirus, her chances of survival were automatically decreased. Her family are left hurting.
When she left this house going into a coma, that was the realization of how serious it was. And I was nervous that once she'd left this house, she wouldn't come back. And that's ultimately what happened. I couldn't even be there to hold my mum's hand. Do you know what I mean? And that's something that just burns me for the rest of my life.
After being instructed by the government a month and a half ago, Public Health England released its review looking at why people from a BAME background are disproportionately affected.
Thank you very much. This work underlines that being black or from a minority ethnic background is a major risk factor.
And the Health Secretary's choice of language was particularly poignant in light of current global events.
Black lives matter, and as do those of the poorest areas of our country, which have worse health outcomes, and we need to make sure that all of these considerations are taken into account and action is taken to level up the health outcomes of people across this country.
The review looked at health records of at least 1,000 people and the impacts of deprivation, age and geography. The findings found that in black ethnic groups, 486 women and 649 men were diagnosed with COVID-19 per 100,000 population, whereas in white groups, the number is significantly lower, 220 women and 224 men per 100,000 population. People of Bangladeshi ethnicity had almost twice the risk of death, and people of Chinese, South Asian and other black ethnicities had between 10 and 50% higher risk of death when compared to white people.
Our work very strongly suggests that the increased risk for black and Asian people is not attributable to a higher prevalence of other medical problems or deprivation among black and Asian groups. So that means that we have an outstanding mystery, if you like.
Some organisations fear this review may have come too late.
It has no plan of action, Beth. It doesn't ask the question of how can we save lives.
This virus has brought to the forefront systemic issues that governments have long since been aware of, social inequality and increased deprivation within the BAME community. As a result, change may occur, but it's taken a pandemic and thousands of deaths to reveal it. Inzamam Rashid, Sky News.